Good afternoon. Want to welcome everyone today. It's a pleasure seeing each and every one of you. Want to officially welcome you to our first quarterly commission meeting of 2024. It's hard to believe we're already into 2024. On February the 14th, well, before I get to the next section, I would like to actually go to Deputy Chief Justice Lambert, our commissioner. Hopefully, I think she is joining us by phone today. And before I get too far into today's agenda, we'd like to give her an opportunity to say a few words for us, or as many words as she'd like. I'm smart enough not to cut the Supreme Court off.
Oh, thank you, Deputy Chief, Chief Judge Larry Thompson. I'm happy to be here today. I put on my sunglasses so you can perhaps see the reflection of Florida around me. Unfortunately, I'm not able to be here with you in person today because of a family member, my son, having some follow-up tests down around Jacksonville. So here I am remotely, but I am very interested to hear all the updates and committee reports today. But otherwise, I'm going to remain a little bit quiet because I think it must have suddenly become bike week this morning. But thank you all for making the time to be here, either in person or joining us via Zoom. Thank you.
All right, then. Thank you so much. Want to remind everybody, it's just a little bit of an update. On February 14th of this year, Chief Justice Van Meter signed a new order appointing some new members to our commission, and we'd like to take an opportunity to welcome those members. I think at our last executive meeting, I think our Kentucky Attorney General, Russell Coleman, had joined us, but he has officially been appointed to the committee. I think he has designated Will Schroeder to appear here today. Will, we're so appreciative of having you here joining us today. We also have Diane Thompson, Nelson Circuit Court Clerk, up there in the corner. How are you doing today? Good to have you with us. From the Kentucky Sheriff's Association, Shane Stevens. All right, looks like we have Shane online, and we're glad to have him as well. Keith Jackson, Secretary for the Justice and Public Safety Cabinet. All right, then. Well, thank you so much. We appreciate having you with us today. And last, and obviously not least, David Livingston, President of the Kentucky Association of Counties. To your right. All right, then. Well, it's good to have you with us today. Additionally, Tom Vicini, President of Operation Unite, and Crystal Adams, Director of the Division of Development and Intellectual Disabilities with the Cabinet for Health and Family Services, were appointed. I know Tom and I think also Crystal have been with us before, but now they've officially part of the committee, and we're glad to have them here with us as official members. I would tell everybody, if you check your handouts that are given out prior to coming in today, there should be a list of the new committee members. If you need to contact them, I do believe we have emails and cell phone numbers, so those have been updated and including in your binders. As far as the commission itself, we have a couple new members. One we referred to at the last meeting, but we want to introduce those. During our December meeting, I think we introduced you to Becky Heisel. Is Becky here with us? Becky, everybody always loves waving the hand at these things, but glad to have you with us, the new Administrative Support Coordinator for the Commission. We're also excited to introduce Maria Macaluso. Maria, I think we may have introduced you also at the December meeting, but we're glad to have you joining with us today. Maria is a 22 graduate from the University of Louisville Brandeis School of Law, has jumped right into the commission work, and I think she's been kept busy so far researching statutes and processes, and we all believe she's going to be an excellent addition to our team. With Maria coming on board, the commission now is, I believe, according to Shauna, fully staffed, and that's always good. Please know that you can reach out to any of our staff, Shauna, Jennifer, Becky, or Maria, for any assistance you may need. If you are unable to get to them, Shauna said, please call her at home. She's always good about taking phone calls. I can't say she's eager to hear from me, but she always takes my phone call. No, seriously, we have a wonderful staff, and I think you, as most of our staff here at AOC, they're always willing to help. If you need anything, please give them a call. Few updates this legislative session. For those of you that are following the session, and most do because most here are state employees, I do believe, and we all like to see if they're talking about raises or significant other laws. But House Bill 385 is the commission's first legislative package. I will tell you, it passed unanimously from the House floor on February the 21st and has been assigned to the Senate Judiciary Committee, and we hope to see it on the agenda soon. I can tell you we're getting down to, it seems like this session's went on very long, but we're now down to April 15th will be the last day. So we seem to, I'm sure we can anticipate a flurry of bill passages and work in the next couple weeks. And we hope House Bill 385 is one of those. Just for those of you that may not have had an opportunity to take a look at House Bill 385, it addresses basically three issues for us and adds adult friend to KRS 311-631, allowing an individual with little or no known family to have a trusted friend make medical decisions on their behalf. I can tell you as a former district judge, that is a vital piece of legislation. It also amends part of Chapter 504 to allow a defendant where competency to stand trial has been brought forth an issue to be evaluated on an outpatient basis by a psychologist or psychiatrist, and if further evaluation is needed, then that individual would be referred to an inpatient facility. And again, this is one of those we think that will be a huge asset and help to the criminal justice system. And lastly, and very importantly, the bill's name will be named Seth's Law in honor of Seth Stevens, our previous commission attorney who we lost last summer. So we think that would be quite an honor, and we're very pleased that we'd have an opportunity to ask that. In regards to House Bill 385, we have to also give thanks, and I was looking, she may not be here. I heard her day job's keeping her busy right now with the legislature, and that's Representative Kimberly Moser for sponsoring the bill. We appreciate the fact, I know when we were discussing sponsorship of the bill, I'm pretty sure that was the first name that popped up with our group. So we appreciate so much the time and effort she's put in to that. In addition to Representative Moser, we also want to thank our director, Katie Comstock, for the work she does. And I can tell you every Monday we are pleased to get to spend about an hour and a half to 2 hours with each other looking at this legislation. But she's done an amazing job for us this session. Stacy Tapke, Colleen Slusher, and Wes Butler, all of these individuals have gone above and beyond for the commission and the work on our first bill, and we're so appreciative, again, of the time and effort that they have put into that. Upcoming events, for lack of better terminology, we are still hoping to plan Mental Health Summit in 2025. For those of you that were with us last year, you know, it was just an amazing success. I honestly, I can remember going into a couple months before, and the thought was from the executive committee, can we get 300 people to show up at this? And I think our final numbers were, I think, in excess of 1,100. So it was an amazing success, and we had support from every county in the Commonwealth, and we're so appreciative. Right now, we're in the planning phases for the 2025 summit. If any of you would like to be on that committee, I'm sure everybody in this room has just all kinds of free time. But if any of you would like to serve on that committee, please contact Shawn, and I know she would be more than glad to add you to the list to work on it. Also, we are looking for some input. If you had any ideas as far as funding for our next summit, we would greatly appreciate those. Anything you may think of. The last time, and I'll give credit to the Administrative Office of Court, the court system picked up the majority of the funding of that with some federal grants. But as you all can guess, it was an expensive project to put on, and we're always looking for alternative sources of funding. So if you have any ideas of anything we can look into, we would greatly appreciate that. Also, we are also very excited, and we're very close to the getting the information and updates from our town hall meetings. Just show of hands, how many were able to actually attend some of our town hall meetings? I have to admit, we are so appreciative, but it was such a wonderful, wonderful group of meetings, and it was just amazing. I thought the turnout that we had, the input that we got from the public, and ultimately, one of the reasons we're working for this is to improve and help the public and the people of the Commonwealth of Kentucky. And we just had an amazing outpouring, I thought, of suggestions. And I know we're working on that as we speak. We've received the data, it's being reviewed, and we want to hopefully be able to release that. Do we have an idea, Sean, or when hopefully that may be?
Definitely by the next quarterly meeting.
Okay, well, good, good. I look forward to looking at what the findings are. I want to give a special thank you to Secretary Freelander, Commissioner Marks, and their staff for reviewing the data that was collected, providing feedback and a draft report, and also the data teams here at AOC. I truly believe we have a data team for everything here at AOC, but honestly, we appreciate so much that we have people that are able to actually compile that information and break it down into a format an individual like myself could understand. I give everybody else credit for understanding all of it. We also have added to our webpage an opportunity for communities to reach out to the commission if they are interested in a pop-up town hall event. We're always looking for input, and I've said from day one of this commission, the key to this commission is the outreach that we have in our individual communities. In family courts, it was so crucial to us to get the involvement of our local communities, and likewise with the Mental Health Commission. It's so important what we do, but I think the big impetus for us to help us out there is getting our local communities involved. So if you know of your local communities or anyone that would like to host a pop-up event, the last time, please let us know. I know the last time we were so thankful to the Kentucky Bar Association, we were able to work with them in conjunction with their law update that they put on every day. And it was a great benefit to us not have to find separate locations for things of that nature. But if you know anybody in your community that's interested, let us know, and we were more than glad to travel and come to the communities. If you know of anybody, refer them to the webpage or call one of us, let us know, and we'll follow up with them. One of the most important things I think we do during these sessions is let's get updates from our committee. And next on the agenda is our committee and work group updates. I think first turn it over to Judge John Tackett from the Criminal Justice Committee update.
Thank you, Chief. So the Criminal Justice Committee has three work groups, and we're actually adding a fourth, and that would be so we want to welcome our newest work group, and that's going to be our reentry work group. And I'm going to turn it over to our work group leads in a minute to talk about what we've been doing individually. The small groups that we've put together have allowed us to explore topics, and we've entertained a lot of deep discussions regarding each action item. And unfortunately, I haven't been able to attend all of them, but I've attended quite a few, and just to attest that there's been a lot of sharing of ideas and thoughts and planning that has been going on. And as you've stated earlier, Chief, we're really excited about House Bill 385, which is cess law. One thing that Director Slusher is going to probably talk about that a little bit in detail, but it would allow for outpatient competency evaluations, and that would be tremendous to reduce the competency backlog that, as a district court judge, I see quite often every day. So we're excited about that becoming possibly law. One thing that I wanted to speak individually about is our pre-arrest work group was able to visit a Clark County deflection program. And that was tremendous. And unfortunately, Judge Mayer, she couldn't be here because this is something that's happening in her county, and she could speak to it a lot more detail than I can. But it's a executive branch led program. It's a police driven program. And it's come about because police officers they're realistic. They've seen folks who are in addiction, who they arrest, and we've all seen that revolving door where they are getting probably a credit for time served offer and then being turned out, and there's just really no progress. So this program is really aimed at folks with either mental health issues or substance use disorder who are really hard to engage. And it's basically giving an officer, and I think this is why the law enforcement community really loves it, is the discretion remains with the police officer. So the police officer is making that decision on whether to arrest, cut loose, and then they're given a third option, and that's to deliver that person if they're willing and they're not, and they meet criteria. For example, there's no sex offenders. There's certain criteria that they just couldn't have folks show up at this program. But if they meet criteria and they're willing to send them to a recovery center, which is led by a clinical social worker, licensed clinical social worker, and it's peer driven. So folks who have a lot more credibility than I do, who have actually been in recovery and are suffering for these substance use disorder or mental health needs, are talking to these folks and bringing them along, and they're making sure that they have somewhere safe to go, and they're doing assessments. And remarkably, 95% of the folks in the LEAP program at Clark County come back. And we heard that over and over again that sometimes, they're not sure if they know the person that the police officer dropped off with, if they even know where they are. But they've had a remarkable rate of engaging folks post, assignment 95% of the time, which is amazing, I think. So then they get on to a recovery plan. And these cases they are put on a special docket so they don't get lost. So, and that's something we've been talking about in Lexington is, the police don't know, they're worried that they wouldn't be able to put them in a diversion program and keep track of unprosecuted cases. But these cases, there's been a lot of buy-in with the county clerk's office and the county attorney's office, police. So they're tracking these cases. And if they fail at their diversion program, then they will be prosecuted just the normal way through a court case. But it's been exceedingly successful. They've started out with a lot of harm reduction. They told one remarkable story is a young man who's 20 years old, had been homeless for 15 years and seriously addicted to substances such as methamphetamine. And he asked for a tent just to start out with. They've been wanting to engage him for some time. After he graduated the program, he is a real beacon. He's a magnet for folks in the community because they know him and they trust him. And he was able to get sober at, 15 years later. So you heard a lot of wonderful stories like that. So at any rate, if anyone's interested in, talking to either me or Judge Mayer about starting that program, we are unfortunately, unlike Judge Mullins, who is from a SB 90 county. Our folks in Lexington decline SB 90, and I'm very jealous of Judge Mullins for having that program. But we're looking for something along the deflection, the sequential intercept model 01 in Fayette County. I want to steer our folks to. And so we've actually sat down with a lot of our big chiefs, clerk, sheriff, some folks from the paramedicine team, as far as Lexington Police Department, downtown, who are dealing with folks who are housing insecure and homeless day to day, and they're realistic. I mean, they know that this is not getting it done, incarcerating folks. So I'm encouraged by our preliminary meetings. We're thinking about maybe expanding on those meetings. I can't say for sure if this is something that is going to be green lighted, but that was a big help, and I don't think we would be at that step if we weren't sharing information through this judicial commission. So I just want to say that's some stuff that's moving in, I think, in the right direction, all due to this commission. So at any rate, I'm going to turn it over to Director Slusher, and she can tell you about what's going on in the competency work group.
Hi, everyone. Can you hear me? Okay. Thank you, Judge. So some of the conversations we've had in our competency work group have been learning from the Council of State Governments, who's our technical assistance advisor, about how screeners are used throughout the country and other states for determining when someone needs a competency evaluation. What we've mostly found is that screeners are used to determine mental health needs, and those don't, as we all know, align directly with competency a lot of the time. So we're still trying to learn a lot more about that process. We too have talked a lot about diversion opportunities to keep people out of the system where that's appropriate from a competency evaluation perspective, and just trying to identify how we can build that continuum across our state. We have discussed how judges can rescind competency evaluation orders. We have a lot of expertise on that work group to help us think that through in technical terms, because there's often cases where there's grounds to consider that we don't need a competency evaluation, but once that process has been started, we stay moving forward on that. And so we are thinking about all opportunities to kind of clean up that system where it needs some work. So House Bill 385 is what we've heard a couple times mentioned already, and that is to modify the evaluation process to do outpatient evaluations for in-custody defendants and cases. And that will not just affect KCPC, but our state psychiatric hospitals as well on misdemeanor cases. So all of our state hospitals take care of those competency evaluations for misdemeanor charges. It will modify their process too. KCPC, as a reminder, we've been doing that for about 1.5 years now. We have tremendous success, but we still have about 30% of our orders that come through are inflexible, and that adds up very quickly. And then we have done some work on, as a reminder, KCPC serves our KRS 202C population. And so as that law has taken effect and we've seen people move through that process, we've had to make some modifications to forms in partnership with AOC, who's been able to add 202C language, for example, on the treatment plan component of civil commitment and involuntary medication, those kinds of processes. We've had success there, and those are now posted on the website, which is a big success for us. We continue to talk about doing a CLE training, but we want to see how House Bill 385 works out, because that will help guide that training process, so that we should know more about soon. We continue work on updating the forms for AOC for firearms prohibition. So that has come up several times about when someone is adjudicated incompetent, how to move forward with the firearms prohibition in a clean way where that data gets where it needs to go. And then every time we have the opportunity to talk about community-based restoration models, we plant seeds around that. You've heard me talk about our pilot project in Louisville, which we continue to expand and are having a lot of success with. We have a medical provider in that facility that started on March 1st, who has staff who are very dedicated to the competency restoration model. So in the next 6 months, we will learn quite a bit to share with the rest of the state. And that's it, unless you have questions about KCPC. All right, thank you.
Director Schlesser, if I could ask you just a very quick question.
Yes.
Do you have any type of idea with the passage of House Bill 385, how much the workload will be reduced? I know your department has an amazing amount of workload, but it seems like that would be such a benefit to be able to utilize some of these other locations for these evaluations.
Well, so it's a complicated answer on some level, because the data shows us that the number of orders we're receiving, regardless of inpatient or outpatient, are going up statewide. So from year to year. So this past year was an increase of 17%. So as those numbers goes up, but the quantity, regardless, it will increase the number of patients we have to serve just across the whole state. So if 30% of those are inpatient requirement and we were able to see them outpatient, it would open up the beds for restoration, move people in quicker. Right now, the last numbers I checked, we have between 60 and 70 people who are waiting on an inpatient evaluation. So if you took them off of that inpatient list, you could move in restoration patients, and we have about 2/3 of our wait list are waiting for a restoration bed. Does that help?
It
It's
does.
like-
And my reading of 385, I thought that was one of the major aspects of
It
it to
is.
help with that.
Yeah, so it would allow us to provide our beds, which we have a limited number, of course, it's a small number, specific to restoration, and it would move people a lot quicker through, but those numbers change constantly, just depending on how many orders we receive.
Thank you very much.
Sure.
Next, we'll hear from Judge Lisa Jones in the Juvenile Justice Work Group.
Thank you. We met on February 21st, and part of our meeting on that day was to review the state auditor's report, and we're grateful to Auditor Allison Ball's office for taking the time to review that report with us and the data that came out of that auditor's report of the Department of Juvenile Justice. So we really took a deep dive into that data, and then we had a discussion amongst our work group about that. And I brought up a lot of issues. It was a lot of sensitive topics, but it's information that is very relevant, especially in light of the legislation that's passing, where it looks like more juveniles might be funneled into our juvenile justice system, to know what those conditions are and what needs to be done to improve that. We also have received returns from the National Center of State Courts on our mapping of our juvenile justice system. And it took some time for them to get the data to us, but it looks really good, the final report. And what they did was they combined upstream, which had been done involving the dependency, neglect, and abuse system, with the data that they got from us when we worked on the juvenile justice system, to put it together, because there was so much overlap between the populations and between the services. So they have that laid out, and we're continuing to review that and see ways where we can identify gaps and make sure that the data is reading as easily as possible. We are also continuing to look at pro-social activities. That was one of the things in the process of doing our state mapping that we realized was a big gap, is pro-social activities for our young people, especially on a statewide level, something that's uniform across the entire state. There was such a dearth of resources. And so they were very community specific where there were some. So we were trying to identify more and more of what could be taken and brought out onto a state level. And we're continuing to look at that. And that's through the Social and Emotional Health and Wellbeing Standing Committee of the SEAC. And so they have really taken the lead on that and presenting that and getting that up and going. We also sent out surveys to our CDWs and to our county attorneys regarding vaping and how that is treated county by county, so that we can kind of, again, look at where there's uniformity, where there's not uniformity, the reasons for that, and to see what we can put in place maybe statewide to try and provide resources to deal with that. And again, funnel those young people into diversion or into school-based programs rather than sending them through the court system. So kind of it in a nutshell. It was a quick report this time, but it was a whole lot of information and a whole lot of data covered and a whole lot of conversations. Any questions?
Okay. I neglected to mention this too. I know that we're having our district court judges meeting in September, our educational meeting, and Chief, you'd asked me earlier, if any of this information is being disseminated sort of down to our district court judges. And I'm really happy to say that Justice Lambert is going to be willing to kind of give us an update during that meeting in September as part of a presentation that I'm giving. So we're trying to get the word out that way. Just want to let you know. Also, we'll go ahead and go to Joe Ross and Jim Daly for the pre-arrest diversion work group. I don't know if Mr. Daly's available or not. There he is.
I am. I apologize, I couldn't be there today, but I've got like 900 meetings going with the legislature and et cetera. So the pre-arrest and diversion work group has explored several topics, including police social workers, deflection, and crisis intervention teams. And I would say that Alexander Police Department, which was one of the originators for these programs, highlighted the roles and benefits that they have seen and the challenges to keeping the role in place or expanding it. And I would also tell you that from the jailer's perspective, several of us are looking to get social workers in our facility. Some already have them, but I think it's few and far between, but we're looking to expand that. The work group has discussed potential funding opportunities to get multi-jurisdictional law enforcement social workers across Kentucky. The Recovery Community Center model and law enforcement assisted programs in Clark County. I think we heard a bit about this earlier, shared on how their programs increase people's connections to community service resources and deflection from incarceration. The work group will continue looking at deflection efforts in different counties to determine best practices. The QRT National shared the opportunity to host deflective academies in communities across Kentucky and invited any interested communities to reach out. Our work group continues to explore opportunities to get officers across the Commonwealth access to crisis intervention team training. An overview of the curriculum and content was reviewed, and focus has shifted to getting departments access instead of proposing changes to current content. The work group also discussed a potential jail survey to be administered to all jails across Kentucky for purposes of making appropriate jail recommendations. Survey would specifically ask jails to provide information on access to care and medications. Action items, research law enforcement social worker, funding options and resources, report out from CIT annual conference, and of course the jail survey creation, which I think, Shauna, I think I volunteered to help with that the other day, but I'm sure she'll reach out and touch me if I didn't. And I think that's it for this group.
Thank you. Last but not least, we have our reentry program. So it's Director Erica Hargis is going to give us a report.
Thank you. So we're new here. We identified that this group was needed. As many of you all have reported out, and we talk about a lot of things before someone's going into custody. It was clear that we needed a work group to talk about when someone comes out of custody and what that's looking like. So we just had our first meeting on March 8th. We had a great turnout. We sent out a lot of invitations. And where we kind of came up with the names, some people had reached out directly to Shauna saying, they were interested or they wanted to send someone to the committee. We also have a robust division of reentry services within the Department of Corrections. And so we took all of their contacts and networks and kind of put fillers out that way as well. So we are not saying that we're settled on our membership. If there are members that you think that need to be on this work group, as with anything, please reach out to Shauna, get them an invite, because we want to make sure that it is a conversation that's inclusive of every person that needs to be there for that conversation. What we did on the first meeting was just do introductions and kind of see where everybody was, and then get a little bit of ideas about barriers and maybe where we want to go. And so we're very new into the conversation on where we're going to head with this. We want to continue to explore those things, continue to explore what gaps in the people first, then the gaps in the resources. And so once we have everyone at the table that we think is important to that conversation, we're going to be identifying our goals and working on a work plan. We have some speakers identified already, people that have already reached out that are interested in coming to speak to this group. And then we've already had some ideas that Shauna and I are going to discuss and explore as well. So very new, not much to report from March 8th till today, but very excited for us to get started on this. Hoping to get our action plan. I kind of envision for the next few meetings that we will really hear from any new members that have come, and we'll really kind of start to gain momentum on where we're going. We want to be clear about what is happening with the Department of Corrections and then what is happening with jails, and really talk about reentry in all aspects. There were some filters we put onto it. Because of the juvenile justice work group, we are only going to be talking about adult reentry. I think that's important, that if someone has an idea and they think, oh, well, let me send this Erica's way. For right this second, at the beginning of this work group, it's going to be more adult reentry focused, so that the juvenile justice work group could work on if there's any reentry things that they wanted to work with juveniles on. So That is what we've got going. Did I miss anything, Shauna? Is that good? Okay. Thank you all, and we're excited to get this work started.
Judge Tackett, we appreciate you and the work that your committee's done. Now, I think we'll go to the Honorable Jay Foster cutoff. I do believe we spend far too much time a week in sessions with each other here. But he is with our Civil and Family Justice Committee.
Thank you, Chief. Yes, I'm ready to go home. So yes, I've lost my voice and it's actually coming back. It's far better than it was on Monday, so I don't plan on talking very much. Our committee last met on February 15th, and we had some robust discussion there, and I'm going to let our work group people tell you about what we talked about since I sound like a Muppet. Our work groups are forming subgroups, so we're going further down the chart here because we have so much to talk about to continue focusing on their work plan priorities. And their focus is based on the reviewing of forms from AOC and proposing change or creation to standardize the tracking of information and outcomes and ensuring smooth transitions that we're looking for. We're also looking at education and reference sources for judges, clerks, counsel, community supports, and families on best practices and processes. And we're looking at awareness and anticipation of potential legislative changes, including coming from our bill. We're going to start with our guardianship and commitment work groups, and that used to be one work group, and now it's the guardianship work group and the commitment work group. And those are led by Stacy Tapke, who I believe is online. Stacy, take it away.
I am. Hello. I'm going to jump it right in and say House Bill 385. Not much more to add to that other than curiously, we got more questions about the friend language being added when we testified before the House Judiciary than anything else. One thing about 385 that is a good point if you talk about the legislation with anyone. I think between the reduction, hopefully, in guardianship cases, as well as moving people faster through the justice system, that it will be a cost savings, particularly to counties. I see my friend David Livingston sitting there, so hopefully his ears perked up at possibly saving some money at the county level if that bill gets passed. That's been a major focus of the guardianship group, as well as talking about forward-looking some changes that probably need to be made to make guardianships more streamlined across Kentucky. We have a survey out to district judges, clerks, and county attorneys as well. We're going to review the results and kind of see what that leads us to. We also are working with AOC staff to get a restoration of rights form created. What we've found is a lot of times you get a really pretty order that sets out the guardianship and conservatorship, but when it gets when that's no longer in place, there's not a pretty order for anybody to take back to everybody to show that you're no longer under a guardianship or conservatorship. So we'll keep moving forward with those. Shifting to our commitment work group, focusing in on the involuntary 202A in particular. We have been doing a lot of educational pieces to our committee meetings because we've realized there's so many things that we need to understand before we can make good recommendations. And that has been learning about Medicaid waivers, especially whenever someone's admitted for mental disease versus a physical medical situation. Commissioner Lee is looking into that further. We got educated on understanding the Medicaid review process to suspend coverage when you enter into a mental health facility. We also heard from our mental health hospitals, especially Western State, and kind of the challenges that they're seeing with our elderly mentally ill, and the great challenge that they face to try to place people upon discharge from the hospital, that they just can't find places for these individuals to go, and that's a challenge. And then let's see, and we're continuing just to try to focus in on the forms for 202A, B, and C just to make sure that those are clear, and maybe divide those up a little better. So there's a lot of work to be done there. So that's, in a nutshell, our work.
Thank you, Stacy. Does anybody have any questions for her about the commitment or the guardianship work groups? She did a great job testifying, so we appreciate all of that. It's a daunting task to get up there at any committee meeting, regardless of how much support you have for your bill. So thank you for doing that. Next, we'll go to Judge Denise Brown to talk about our domestic violence work group, and she is also online.
Good afternoon, everyone. We are in the details of working on all of our bench cards. We had a meeting scheduled last week, but we had to reschedule to get everyone time to take care of what they needed to. So I'll just give you a summary of some of the things that we are going to be working on in our subgroups. We have already discussed the projects relating to the Violence Against Women Act and multidisciplinary teams, and creating bench cards for best practices when the petitioner seeks to withdraw a petition. That seemed to be a concern statewide, that we were not using the same standards. Not that there was a concern about whether it was correct, but that we have different processes. And some of those processes seem to inform the victims a little bit more than others. So we're wanting to provide all those resources to the judges statewide so we can provide good information. Also looking to develop some training and professional development opportunities regarding teen sexting and suicide as it relates to domestic violence. And our subgroups are going to focus on the following areas in more detail. We're looking to develop bench cards with technical assistance updates and a creation of best practices across several different subjects in this arena. We're looking to identify multidisciplinary teams, best practices, and models, and exploring sexting, harassment, and the lethality issues surrounding that, and then presentations on prevention models. And of course, we'll be doing that through our subgroups and coming back and reporting to the larger mental health group. And that's our report for this session.
Thank you, Judge Brown. Does anybody have questions for her? All right, moving on, we'll go to the Dependency, Neglect, and Abuse Work Group. That is led by Judge Vanover, and he is here in the room.
Thank you. In regard to our Dependency, Neglect, and Abuse Work Group, we've kind of been working on two processes. One is we've been working with the upstream plan, and then the other we've been working on specific priority areas. I'm glad to say that this time at our meeting, we get to show you something concrete from the upstream plan. You should have a handout with your with the results and report from our upstream mapping workshop, and that you each of the commission members has today. In regard to upstream, this recommendation and report that was submitted by the National Center for State Court contains recommendation focused around courts as conveners and leaders, education and training, data-driven decisions, peers, individuals, and with lived experience, and families, and service delivery. After we received the report, we had a state planning team meeting on March 5th to review these recommendations and discuss what the next steps are. As Judge Jones had pointed out previously, several of the recommendations, there was some overlap with juvenile justice, and once they started looking at the overlap between upstream and juvenile justice, they realized that there's some overlap in regard to the sequential intercept mapping that was done earlier last year. We're currently working with the National Center to provide a facilitator training that will work with all three of the mapping reports that have been done. All three of the departments within AOC's statewide programs, Family and Juvenile Services, Specialty Courts, and Pretrial Services, have now identified potential facilitators who will initiate the sequential intercept mapping efforts on a local level across the state. These mappings will include, as I said, the adult criminal system mapping, along with the child welfare through upstream and the juvenile justice that was referenced earlier. The idea is that if we can map all three courts at the same time, as many as that we have crossover that have touched into juvenile justice and in child welfare and into the adult criminal court system, we may be able to better address these matters further on up to prevent court involvement. Having participants able to hear the resources and challenges in each of these areas will hopefully better lead them to find solutions for families involved in the courts. Kentucky is the first state to incorporate all three levels of mapping simultaneously, and we will learn what works as we go through the process. We're looking forward into June of 24 when we will be having the facilitator training. Once that is complete, we will be moving forward with mapping at the pilot sites out in the state. As far as the priority areas, the DNA work group met to discuss those on February 9th. At that meeting, a discussion was held regarding our court outreach program. That group will be working on a series of trainings dealing with relationships matter too. That will include mental health component and involve treatment and healthcare providers, as well as child care workers and court staff. The Judicial Engagement Work Group will also be utilized in working to provide more topics for the relationship matters training for that particular priority area. This will be, again, part of the enhancing collaboration and communication with system partners priority. We also are working on coming up with a bench card regarding licensure, assessments, and the role of treatment providers for our courts. Those bench cards are very close to being done, and they have a lot of great information. Once we started looking at them, there's so much information in there that we thought it would be helpful to have a table of contents so that they can cross-reference each of the different areas of the cards, and those are being added to the bench card regarding licensure, assessments, and the role of treatment providers. Let's see. We're hoping that those can be ready and that, as Judge Tackett referenced, the Judicial College for the district judges in September, and we have one for the circuit judges in October, that we will have those also ready to distribute to each group for those colleges. And we're discussing ways that we can distribute those out into treatment providers throughout the state and to the attorneys that are involved in court, and so that everyone can have access to this information. We've developed a new priority area for focusing on training for court-appointed counsel on matters of mental health and trauma. We've begun meeting in that regard, and we're trying to incorporate this into our court-appointed counsel and guardian ad litem trainings that we already do as part of the rules for the statewide family court rules. Let's see. Judges, attorneys, and mental health professionals are participating in that priority area. Additions about relevant court procedures have been added to the Child Welfare Best Practices Guide and are currently under review. So those are the 4 different priority areas that we're working on for the DNA work group. And the next time we meet is on May 8th. And I know we meet again for upstream, but I don't have that date in front of me. That's all I have.
Thank you, Judge Vanover. Does anybody have any questions for him about the DNA work group? Chief, that's our report from the Civil and Family Justice Committee. As always, we'd like to thank Jennifer and Shauna and Maria and their team for all the help that they give us. So thank you.
Judge Cutoff, we appreciate the work your group is doing. We appreciate the update today. Now we'll go to our Treatment and Access Committee, and that's, I think we go to the Honorable Kevin Mullins, who has, I do believe, at least in Eastern Kentucky, we think one of the flagship drug programs in the state, but we'll now turn it over to you, sir.
In every meeting, I always start off with my belief that access to treatment and community involvement is the cornerstone of any successful program or model. In the last full commission meeting, I expressed my opinion that the mental health and intellectual and developmental disability aspects of our commission should build upon the pre-existing structure that we have in place for substance use disorders. Also, I express my opinion that based upon the work of several people involved with the commission and who are present here today, that Kentucky has the strongest foundation or structure for substance use treatment in the nation. And those that I pointed out last time who are again present here today, my belief is based upon the work of Van Ingram, who's the director of our drug control policy, Katie Marks and her work with CORE. I'd also like to thank Elizabeth Nichols, who's behind me, who's with Specialty Courts and is also a board member of Operation Unite. And I see online Tom Vicini, President and CEO of Operation Unite, and my friend Courtney Maynard, who's over the prevention programs. Since stating my opinion that Kentucky has the strongest substance use program structure in the nation, ETSU and Michael Meat have just released a report, and it's based upon SAMHSA's 2022 National Survey on Drug Use and Health. Michael Meat presented at our summit in Louisville, and many of you may have heard how I always describe Michael Meat. In my opinion, Michael Meat is the Michael Jordan of the public health and rural health research world. The findings of the report prepared by ETSU is that Kentucky has the highest number of residential treatment beds per population than anywhere else in the nation. And besides just being top of the nation, in my plain vocabulary, we beat the socks off the rest of the nation. Kentucky's number is 70.34 per 100,000 population. Our closest competition is Utah at 61. There are 2 states that have 50s, Wyoming and South Dakota, presumably based upon their lack or little population. There are 3 states in the 40s. I remember Philadelphia and Minnesota. There are 5 states that are in the 30s, 2 of which are important because they are our neighbors, West Virginia and Ohio. We have double the residential treatment beds for substance use disorder than Ohio and West Virginia. Ohio and West Virginia also started their expanded Medicaid program in January 2014. The remaining states are all in the 20s, including our neighbor of Virginia, which is in the teens, which did just adopt expanded Medicaid. It's my understanding that the governor is going to do a press release on these numbers and findings Tuesday at 12:30. John was kind enough to mention the fact that Letcher County is blessed to be part of the Senate Bill 90 program. And again, I would like to thank Van Ingram and Representative Mosier because some of the initial problems that we encountered were actually corrected lightning fast and legislatively. So they heard our concerns and actually modifications were made. Senate Bill 90 is receiving some national attention. I'm presenting at the RX Summit in Atlanta and the Rise 24 Summit in Anaheim. Also, one county, Washington County, Tennessee, has applied for abatement funds to start a behavioral health conditional dismissal program, which is almost primarily based upon our Senate Bill 90. Given that their chair of the opioid commission in Tennessee is Dr. Stephen Lloyd, who presented at one of our previous Restore Summits, is from the county seat of Jonesboro, Tennessee. I believe it quite likely that they will receive funding in May for their program. I'll talk a little bit about some work that's been done by our work groups, and it's just again, I'm amazed. They've done some fabulous work. Their dedication and devotion, I did not expect. I will first start off with Wes Butler's Strengthening Community Response Work Group. Wes had other commitments and could not be here today, so I'll briefly go over what that work group has done. I think there was previous mention that Wes contributed substantially to House Bill 385, particularly as it pertained to the adult friend portion of that legislation. It's my understanding that Wes, working with the Hospital Association and different hospitals, helped with the drafting and input with various figures and numbers, which they supplied to the members who testified before the House committee. Also, it looks like that work group has met twice. One time they met with and had someone from Eastern State present regarding the emergency psychiatric assessment treatment and the healing or empath model. Yes, vision's getting bad. So they actually heard from Eastern State. They've met a couple of times and have some future meetings scheduled. The Strengthening Community Response Work Group has filed a report, and it's part of the materials that you've received. All right. So next, I will turn it over to the new lead of our IDD work group, Crystal Adams, and she has taken this work group, and I've been overly impressed with the concise plans and timelines that she has in moving this work group forward. And I always mention maybe one of the more difficult work groups because there's very little, if any, models in place to work off of. So in essence, they're having to build from the ground up. So, and they're doing a wonderful job. So I'll turn it over to Crystal to let you tell you what they're doing and what they have planned.
Thank you. We have met twice since our last quarterly meeting. We met in December, and we used the end of the year as an opportunity to look at our work plan, do some cleanup, identify if everything we had listed as an interest was still something we wanted to focus on. We identified a few items that we felt had a lot of significant legislation that we felt was pending, or some programming that was about to be implemented that would impact those topics. And so we felt that we would kind of put those on hold for a while, monitor those implementations, and then take a look back at it in a few months and see whether we felt there was any additional action needed from us. For the remainder of the items, we tried to identify a champion for each area who would kind of make sure that we kept track of that, moving it forward, identified other folks on the group who might have an interest in any particular area to work with that champion, and do some work outside of our meeting time to do additional exploration on those topics and identify what would be beneficial to bring back to the larger group. We utilized our time in January to do some offline planning, some small group work, and continued a lot of our efforts around training, identifying speakers, and folks that we needed to include in some of our future meetings. In our February meeting, we continued to review a lot of data. We have looked at mass incarceration data. We had some good presentation from our members. They were able to get some really good data from some conferences that they had been with, and really take a look at that. I don't think we found anything stunning in that we didn't already know, but it's always helpful to have the reinforcement of the data that backs up the things that we know are of our concern and helps us know that we're moving in the right direction in the areas that we want to focus on. We specifically had a lot of interest in and questions about accommodations for individuals with disabilities and how the ADA impacts that. We were very fortunate that Maria, for her first meeting, we gave her work to do before she even showed up, and she very graciously did a lot of very good research and provided a wonderful presentation to our group on how ADA impacts individuals within the correctional system, and what some of the challenges are to that in terms of safety and availability of resources to make those accommodations. That feeds into some of the additional work that we're doing, particularly on the training side. A couple of areas that we've identified are people with specialized communication support needs.
At some of our town halls, we know that that was a topic that was brought up, especially for individuals who are deaf of hard of hearing. And so we are very pleased that we have added a member to our group, Michelle Niehaus, who is from the Department for Behavioral Health and specializes in that area, who's going to work with us and provide some expertise and education in that regard and help inform some of our trainings. And really looking at the universal design model and how we can not only impact individuals with intellectual and developmental disabilities, but people who have a wide variety of accommodation needs through some of these universal design concepts. And we're excited to include that in some of the trainings that we're working on currently. We're also very excited to hopefully kick off soon some of our work with autism in the courts. We are working on right now doing some planning. I've managed to get on Shauna's calendar here in the next little bit to do some talk about perhaps a kickoff activity. We have been working on autism in the courts offline. We have been very fortunate that Tal Curry with our Office of Autism, who has very graciously either offered or maybe I just dragged him in to assist with this project. And he has identified some self-advocates that are also people who have extensive clinical experience as well, and that's a great combination. They have been reviewing some of the information from other states, but specifically Pennsylvania, that we know has done an autism in the courts program, and looking at what they've got and hopefully trying to finalize our curriculum soon so that we can get started on actually putting that together. We do have several trainings in process that we're very excited about. One of the things that we have been trying to do is be very thoughtful as we draft those trainings to the work that's going on in our other work groups. For example, I know the DNA work groups talked about trauma specifically, and we know they're doing some great work on that training. And so we want to make sure that as we identify information for our population, that we're working very closely with these other groups to make sure we're not redundant or creating any conflicts in the information, and that what we can do is take that information and build onto it and add on the specific information that will benefit individuals with intellectual and developmental disabilities. We hope that we are going to continue our work as we go through intercepts 2 through 5. We did take a pause on that because we identified some folks that we wanted to bring to the table that were unfortunately going to be very occupied during the legislative season. So we have shelved that for the moment and focused on some other items, but we are looking forward to getting into that as well and identifying some additional areas that we can focus on and activities that we can do to enhance the supports for individuals with IDD. Thank you.
If any, Dr. Sessions?
I'm very excited about this.
Just a second, we'll get you a microphone.
I'm very excited about the numbers regarding the residents for those who suffer with recovery. My question is it, are we worse per capita across the nation, or are we just better at even than those who have higher amounts of individuals suffering with recovery? You understand my question?
I believe so. Are you asking, is the problem worse here? Is that why we have more beds?
Yes.
Okay. To answer your question, yes, it is. And it historically has.
In the country?
Yes. Our numbers are significantly higher than the rest of the country, and especially, we've all heard of the first wave of the opioid epidemic and, how it took place in, Eastern Kentucky and the Ohio River Valley. And the reason why is, we've had a longer history with substance use disorder than anywhere else. I mean, the reason Purdue Pharma released the prescriptions in these areas, because at that time, the opioid prescription rate was in those areas were 5 times higher than the rest of the country. What makes our structure better than anyone else is that we started fairly soon, and we made a lot of mistakes. You always hear me talk about Operation Unite. Operation Unite got started in 2003. So we've had 21 years to build this structure. The problem is worse here, and then there's all kinds of reasons that factor into that. Poverty, lack of education, trauma is a big factor, you know. So yes, it is worse here. I mean, we've had a horrific problem. But the response to the problem is what's impressive to me, is that what we were able to do is, you know, access to treatment. You know, we have more residential beds per population than anywhere else in the nation. And I mean, when you talk about it, when you look about the treatment destinations of Florida and California, you know, most people can't afford, you know, passages of Malibu. You know, where I live, 60 to 80% of my population is Medicaid. So we've created a system for basically everyone to have the ability to get treatment. And then in Kentucky, we've gone a step further, and we actually have what's called treatment on demand, which is unheard of. When I first became a judge, if I tried to assist someone in getting them into treatment, if we got them in 30 days, we would walk around and pat ourselves on the back like we'd move mountains. And with the adoption of the expanded Medicaid and all the people's work that I just mentioned, it made it where now if you get someone into residential treatment in 30 minutes, you're not, you know, it's just normal. We have the ability to get, the whole key, in my opinion, is like most of these programs talk about, recognize people and then refer them to treatment. And then obviously when you refer someone to treatment, you want to be able to get them into treatment as soon as possible. You don't want the, you know, the worst scenario would be you refer someone to treatment. Between now and the time they get in treatment, that person has an overdose and dies, because it's kind of the same story as you can't treat a dead person. You know, don't care how good you are. If you're dead, you can't treat them. So we have to get them into treatment. And that's what's important to this to me, is the fact, you know, we have no wait. We have a lot of different facilities. Does that mean our system is perfect? No. There's certain populations that we need to work on, and one of which being the veterans population. So we're good. Yes, sir.
I'm used to this because I do it at church. So there should have been a hand clap when you said those numbers. So I'm going to go ahead and clap by myself if I need to.
Okay, well, thank you. And again, this clap is for the people that I mentioned earlier. I'm just the guy that likes numbers. So I appreciate your question. I hope I answered it. And if you have anything else, feel free to catch me or call me. All right. Does anyone else have any questions about what we've went over so far? All right. Our last work group is led by Judge Burke, and to say that she has done considerable amount of work on 202A proceedings and AOT courts would probably be a gross understatement for the day. Before the meeting started, I was talking with Dr. Marks and expressing my belief how the 202A system, which is far from ideal, but to tackle that, my analogy was trying to climb Mount Everest without oxygen. But Judge Burke has made it an effort to keep tackling that mountain, which has many different aspects of it. So I'll let her tell us what she has done and what she has planned for the court responses work group.
Thank you, Kevin. Our work group has been focusing on educating our judges and courtroom stakeholders, specifically with respect to the use of language and terms in the courtroom that would tend to decriminalize mental illness. And in addition to that, we want to educate our judges and stakeholders on options for the seriously mentally ill who they are seeing in their courts every day. Obviously, I think everyone in this room is aware that although we are recognized for our high number of beds for substance use disorder, we are woefully short in the area of what we can do with individuals who are suffering from serious mental illness. Those beds don't exist. And those exist for the SMI adults who are coming into our courtroom. When in December, we were discussing legislation that we were anticipating, but in January, our discussions, and mind you, much of these discussions are outside of our work group meetings. Many of the individuals on this committee are in positions to really make some progress on these issues and to communicate and advocate for some change. So there have been lots of communication and efforts outside of our actual work group meetings to address the legislation that I think everyone in this room probably has concerns about. Specifically, when House Bill 5 came out and we were hearing from legislators that the purpose of this illegal camping provision was to get individuals, homeless individuals, to the court to get them treatment, that the problem with that statement is that only 30% of those homeless individuals who might come to the court are dealing with a substance use disorder or mental illness. And the others are just dealing with poverty. And there's no treatment for poverty. And when we talk about the issue of them saying they're going to get them to the courts because to get them treatment, we don't have treatment available for those who are SMI. We just don't. We have two things right now that we can use, two tools that we have, and those are our mental health courts and Tim's Law, AOT. And our discussions and greatest concern kind of changed away from our focus on working on 202A to advocating for sustaining our mental health courts and our AOT program once we learned that the House had cut off funding for those programs in the House budget. And so in the last several weeks, many members of my committee and work group have been advocating for restoration of that funding in the Senate budget. I can tell you, I learned yesterday that the Senate has included in the executive budget the funding for AOT. We hope and that will stay in the ultimate budget that is passed. Obviously, we need to continue to make sure that the funding for our mental health courts is sustained. You know, we have been working as a court of justice to expand our mental health courts, to expand our AOT courts across the Commonwealth so that we have these tools when these individuals come before us. But without those tools, we are severely lacking in options. And so that has been the primary focus of the members of my work group. I know that after April 15th, I think the first thing we will do is we will address how to respond to whatever the ultimate outcome is of these pieces of legislation and the budget, and then to move back to organizing the subgroup who is going to continue to work on 202A and the language in hopes to expand the criteria under 202A to those who have a serious documented history of mental illness and who are in a state of psychiatric deterioration. And that will be our goal after April 15th. So that's what we've been up to. Thank you. Anyone has any questions?
Any questions about any of the work groups or the Treatment and Access Committee? Not, Vice Chair, I'll submit our report.
Judge Mullins, as we've said earlier, we appreciate so much the work you and your committee have done, and we appreciate today's updates. All right, then, I think unless we have, before I go into the next section, if anyone would have any questions for any of our committees, if you'll let us know, we still have available time. We seem to be moving along at a fairly decent clip today, so we have time. If you have any questions, please let me know or raise your hands. With no hands going, with no hands going up, I will tell you on behalf of Deputy Chief Justice Lambert and myself, we appreciate this commission so much, the members of this commission. is so vital, and we spend a great deal of time at these quarterly meetings getting the updates from our different committees. And the information they provide, not only is it very, very vital to the work of the commission, but it just absolutely amazes me what these committees have been able, and this commission through the committees have been able to pull together since the time of the implementation of the Mental Health Commission, and for that we're so appreciative. But with that having been said, we do have some time available, and what we would like to do is to open the floor up to other members of the commission that may be here today, that you may have something in your community that's working or something that you want to share with the commission, and we would love to hear from you. And I think, in fact, according to my notes here, I think we have Commissioner Lee has been asked to go first. And Commissioner Lee, I do think congratulations are in store. I was advised prior to the start of the meeting that you've been elected president of the National Association of Medicaid Directors. Congratulations on behalf of the commission.
Thank you. Thank you. And I take, my office begins April 1st of this year. I don't know, that's April Fool's Day. I don't know if that's a good thing or not, but I think it's a real thing. I think I was actually elected. And all it means is that I'm going to be able to represent Medicaid programs across the nation at the national level when we talk to CMS. But I think for this work group, as I've sat and I've listened to some of the committee presentations, I keep thinking, oh, Medicaid can help with that. Medicaid can help with that. Because Medicaid currently covers 1.5 million people in the state of Kentucky. We cover over half of the child population, either in Medicaid or a Kentucky Children's Health Insurance Program. You've heard Judge Mullins mention Medicaid expansion several times. Just a little bit of refresher of what Medicaid expansion is. Medicaid was created for a very specific population of individuals. And prior to Medicaid expansion, Medicaid could only cover individuals who were aged, which was 65 and older, blind, disabled, pregnant, or a child under the age of 18. And with Medicaid expansion, we were allowed to cover any individual in the state as long as their income was at or below 138% of the federal poverty level. So that opened up our program to a whole host of individuals who would typically not be enrolled in the program. So we are the state's largest payer of behavioral health and substance use disorder services. And we have been doing a lot of hard work. I say we, typically it's my behavioral health team in collaboration with Commissioner Marks and her behavioral health team, and Commissioner Dennis and her DCBS folks. We have got so many projects going on right now, and I think it's a good time to do a refresher of what all we have in Medicaid. So in Medicaid, we cover a variety of behavioral and physical services through what we call a state plan. So everything has to be outlined in our state plan, but sometimes we want some creativity and some flexibility to design a program that is outside the typical parameters of what the Medicaid program will allow us to cover. So we do that through a waiver. So you may have heard a lot of talk about an 1115 waiver. That allows us to create a little bit of flexibility and design programs around what our beneficiaries need in Kentucky. So we do have an 1115 demonstration that is in play right now. This demonstration, a waiver allows us, again, to waive a federal requirement. So this 1115 that we have in play right now allows us to provide substance use disorder treatment services to individuals in a facility, a residential facility. Medicaid is at a federal level. By federal rule, Medicaid is prohibited from paying for services to a facility with 16 beds or more that are considered institutions for mental disease. So this waiver allows us to provide services in those settings, specifically for individuals suffering with substance use disorder services. We can pay for an average length of stay for 30 days. So that means regardless of the number of individuals in the program, the average length of stay for all of those individuals cannot exceed 30 days, and that's in aggregate. So again, we're asking to waive that exclusion that we cannot cover individuals in those settings. And we also cover methadone treatment in our state plan. That's something that's available to everyone statewide. When we first created that state plan to cover methadone treatment, we did not include our benefit that is non-emergency medical transportation for those individuals who were receiving methadone treatment. We're not sure why that was excluded, but recently we have received approval from the Centers for Medicare and Medicaid Services that pay about 70% of our program. We have received approval to allow those individuals who are receiving methadone treatment to receive that non-emergency medical benefit, that non-emergency medical transportation benefit, so they can receive transportation to those services. And those services also include foster children who were out of state. So Medicaid covers foster care children up to age 26. There are some individuals who may have been in foster care in another state, and if they move to Kentucky, we do cover them in our program, and they also receive those services. We do have a pending amendment to this 1115. You may have heard individuals talk about reentry. So there's another provision that states Medicaid cannot pay for individuals who are incarcerated. So you heard, I think it was Stacy, talk a little bit ago about how Medicaid does not terminate somebody's eligibility just because they're incarcerated. But we do suspend their eligibility so that when they are released, we can turn that eligibility back on rather quickly and get them the services that they need. In addition, if an individual is incarcerated and they have a medical emergency and they have to go to a hospital, they're in a hospital for 24 hours, Medicaid can pay for that service while they are in an inpatient facility. So our reentry waiver it will allow us to provide services for individuals who have a substance use disorder. We will pay for services while they are incarcerated 60 days prior to their release. That will help us provide behavioral health services, some counseling, and when they are released, we will connect them with a managed care organization so that they can receive treatment and more importantly, medications that they need in order for them to be successful upon release. And as part of that amendment that we have pending with the Centers for Medicare and Medicaid Services, or CMS, we also include juvenile justice individuals in that population. So there is a provision that states beginning January 1st of 2025, Medicaid has to have a plan in place to provide behavioral health screenings at least 30 days prior to release for individuals, children who are in the juvenile justice system. We also have to provide targeted case management for them and referrals to appropriate care of services. So as I go through this, again, I think there's a lot of collaboration and work groups, but for all of those committees that are working on juvenile justice and reentry, I think having Medicaid at some of your committee meetings would be very important for us to make sure that we're collaborating and implementing all of these provisions in a way that makes not only us be successful, but have a plan in play for our members to be successful once they reenter society. Some of our future initiatives, Senate Joint Resolution 72 requires Medicaid to apply for a waiver for individuals with severe mental illness, or SMI. And in that, we will provide supported housing, medical respite, and supported employment. Again, we're asking to waive that housing component because Medicaid cannot pay for room and board. So individuals, once that waiver, that 1959, we're also calling it a state plan amendment or SPA. Once it is approved, individuals will be eligible if they're age 18 and older and have a primary diagnosis of severe mental illness or substance use disorder. They have to have a functional impairment, and they have to meet duration and episodic criteria. There's going to be, again, a variety of services, including housing-related support, supported education, employment, transportation, medication management, caregiver respite, which we know is extremely important, assistive technology, and case management. So that has been submitted to CMS and is pending approval. We also have a multi-systemic therapy pilot with 3 providers. That's Home of the Innocents, Children's Home of Northern Kentucky, and KVC of Kentucky. This pilot's a 3-year pilot, so we're coming up on our 3-year. We started on July 1st of 2021, so we're coming up on our 3-year pilot end date. So we will have some information to report out. And just, for informational purposes, for those of you who may not be familiar with multisystemic therapy or MST, it's just an evidence-based intensive treatment process that focuses on diagnosed behavioral health disorders and environmental systems that contribute or influence an individual's involvement. And just like the reentry waiver and the multisystemic therapy pilot, these are designed to keep individuals out of in the incarcerated settings and provide a more community-based approach to services. We also have a mobile crisis program that we're getting ready to roll out in the summer. The mobile crisis, the purpose of it, of course, too, is to expand and strengthen our mobile crisis services to better assist those with a behavioral health crisis and divert from hospitals, jails, and prisons. This will be statewide. Anyone can access these services. The call typically will come through a 988 or a 911. We will have a multidisciplinary team that goes out into the community. One of those individuals has to be an approved behavioral health practitioner or approved behavioral health practitioner under supervision. We have recently awarded 7 grants to municipalities to help them with this response team and to build up the response team, with the goal of having this initial funding to build up and then in the future bill Medicaid for services that they're already delivering, but to expand those services. The agencies that were awarded a grant are Bull County, Christian County, the Cynthiana Police Department, Lexington Fayette Urban County Government, Maysville Police Department, Perry County Ambulance Authority, and the Warren County Sheriff's Office. And if you looked at all of those locations on a map, you would notice that it's pretty much statewide, and we're very excited about that. And we're hoping to award some other grants early on. And again, this is just to help develop a response team and be able to sustain that through Medicaid billing. I'd like to also note that we do not currently have any prior authorizations in process in our Medicaid program for behavioral health services, except for residential. We do not want to put any barriers to care, so that's why we have eliminated those prior authorizations. Another thing, as we talk about children that we're doing, we have been working very hard to make sure that we have a continuum of care for our children to ensure that we can get that preventive care up front and primary care to hopefully make sure that those children receive their treatment in a community and divert them from jails and DJJ, for example. So one thing that we have done is increased our psychiatric residential treatment facility rates. We have heard for several years that those rates were not adequate for individuals to receive treatment. So we did increase our PRTF rates. We also are looking at some of our hospitals that provide behavioral health services to children, increase rates for them, again, to make sure we have that, that whole continuum of care. We are also working on school-based services. Medicaid does pay for services in schools. Prior to about 2019, we only paid for services that were delivered to a child who had an individualized education plan or IEP. That has changed, and now we can provide services to any child that is Medicaid enrolled or enrolled in K-CHIP that has any medical need. We can supply those services. Schools can bill for those services outside of a child's IEP. And along those lines, we're working with DCBS and the Department for Behavioral Health. I'm not going to do your whole BHDID thing, and Department for Behavioral Health on a learning lab or a policy lab with Annie B. Casey Foundation. We've also been awarded a learning lab with the National Governors Association, and we are working on a grant application to CMS that will allow us to expand those school-based services, which we're very excited about that. We're looking at other pilots related to delivering services to children just to make sure that we are ensuring that they receive the care that they need, preferably in a community setting, either in their school or other appropriate facility. We have been working on transportation initiatives. We received approval from CMS to cover triage and transport of emergency medical services. Prior to us receiving approval, we would only pay an ambulance if they transported an individual to a hospital emergency room. With triage, and transport, those EMTs can now treat an individual on site, receive payment for that without transportation. They can transport that individual to a behavioral health facility, an urgent treatment center, a provider office, or somewhere else more appropriate to receive care. So that, again, is going to encourage those providers to deliver the appropriate care at the right setting and not force them to transport to an emergency room if that individual doesn't require that treatment. The other things that we're working on, we have, again, a whole lot of stuff that we're looking at. A couple other things that we've done. We do have, I've heard a lot about reentry. The Department for Medicaid Services has a Medicaid Advisory Committee that's comprised of a variety of Medicaid providers across the state. And then we have, I think, about 20 technical advisory committees that report up to that Medicaid Advisory Committee. One committee that we have is Persons Returning to Society from Incarceration Technical Advisory Committee. That is chaired by Steve Shannon. I don't see him in the room today or on the virtual, but that's 12 members. We have an opening, a vacant position right now for an individual who has been previously incarcerated. So if any of you all know a good candidate that would like to serve on this technical advisory committee, we would definitely appreciate you reaching out to us with that contact information. We also have recently implemented 12 months of continuous eligibility for children and for pregnant women. So what this means is, prior to us implementing that, an individual could lose Medicaid eligibility based on a change in circumstance. If somebody moved out of their household, for example, or if they made a little bit too much money. But what continuous eligibility does is allows those individuals to remain in the Medicaid program for 12 continuous months, so we don't have to worry about disruption of care if an individual loses eligibility. We think this is extremely important for our pregnant and postpartum women. So we also had 12 months postpartum coverage for women. Medicaid used to cover 60 days. Now it's a full 12 months. So we think that continuous eligibility for those pregnant women, particularly those who may have had a substance use disorder, is very, very important in helping them receive care, and again, no disruption in services. And now, I don't know if I've missed anything, and I know we've had a lot of collaboration. Commissioner Marks, do you want to fill anything in or give an update? Do you want me to, or any questions? But I'd just encourage any of you all, if you're interested, to just please reach out to Medicaid for any information on our website related to our Medicaid Advisory Council and our technical advisory committees. We have dates of all of the meetings. They are recorded, they're online, and they are open to the public by Zoom. You can just come into the meetings, and I think that it would be very beneficial for many of the individuals in these work groups to come and listen to all the things that Medicaid is doing. But happy to take any questions.
Commissioner Lee, can you talk about any kind of options for law enforcement transporting on a 202A petition and reimbursement for that?
So I'm not sure if that may be part of our mobile crisis intervention services. Again, what our goal is with mobile crisis intervention is to allow communities to be able to deliver those services, those mobile crisis services. So what we envision is mainly our emergency responders would be a billing agency to the Department for Medicaid Services for those mobile crisis calls. And again, those grants are going to help build that framework so that anytime an individual is in crisis, when that team goes out, for example, there should be somebody on that team, maybe the behavioral health provider or specialist that would be able to bill Medicaid. And we're also going to be sending out, they will have iPads with them so that they can go out and hopefully check eligibility, Medicaid eligibility. And we are talking and discussing about being able to allow those individuals to grant presumptive eligibility for individuals who are in crisis if they are not insured, so that we can ensure payment for the providers who treat them on that day. And again, Commissioner Marks may have some more to talk about on that.
Wow, that's amazing. If that deserves a round of applause in and of itself, that is a breadth of amazing work. And when we think about why we have so much treatment access, so much of that is built upon the infrastructure of Medicaid. You guys have turned every lever that you can. And when you find out about a new lever, you turn that one too. So thank you. I just wanted to follow up with a couple things. The first is that we are releasing our annual report from the past year. And I wish I'm going to share it digitally, but let me just tell you, it's really pretty. And I can't wait for folks to see it. One of the worst things you can do is be a best kept secret. And I want folks to understand all the things that are happening in our Department for Behavioral Health, Developmental and Intellectual Disabilities. I'm going to read just a few highlights and then we'll send this out after the meeting. Keep in mind, these are services that are funded through block grant and federal grants. And there's some overlap with Medicaid, but this is in addition to some really powerful numbers on that side. 152,000 Kentuckians with mental health, substance use disorders, or IDD were served in 1 year last year by our community, and 6,881 clients were served by our psychiatric facilities. So we have an incredible amount of services happening across the continuum. When we think about prevention, this is a mind-boggling number. 33 million touch points of primary prevention were delivered across our state in 1 year. We reached 22,600 youth with severe emotional disturbance just by our community mental health centers alone. And the we is the collective we, not the royal we by any stretch. 118,000 texts, calls, and chats were answered by our crisis lines. CORE alone funded 34,000 people to receive treatment and recovery services, and we reached 8 million people. We reached much bigger than Kentucky with an Unshame anti-stigma campaign. 43,000 clients, unduplicated, were served with serious mental illness by our community mental health centers last year alone, 43,899. And gosh, our jail triage program that screens for suicide risk, recommends interventions, 23,000 people were served by that alone. Our SELs served 4,900 individuals, and Michelle P. reached 10,400 individuals. And we had 8,100 admissions to our state facilities to serve that total of 6,881 people. And so I'll send this out, but it's just an amazing breadth of work across so many different types of initiatives. I'll also just acknowledge the leadership from our state psychiatric hospitals. We had our facility directors meeting last week, and the thoughtfulness, the compassion, the dedication to continuing to build the system and to work in collaboration to build the system is just really amazing. So I wanted to call out our KCPC, Central State, Western State, Eastern State, ARH for that work that they're doing. One of the things that we are hearing from folks, and something I wanted to bring as an offering for the Judicial Commission, is the need for behavioral health training, and we're seeing it arise in different work groups. Sometimes there's overlap, sometimes it's distinct, but what I'd like to propose is that perhaps our department could take some lead in building some core with a C, curriculum around what our court personnel needs to understand across SUD, mental health, IDD, that could be universal, and then to develop some more specific trainings as requested. We'd love to support the uniformity of this, the quality, to make sure there's breadth to it, and to be responsive to work group asks as they arrive. So this is just kind of planting a seed. We can have discussions about how this is most functionally implemented and productive for the commission. Just a few other things. We had a 988 crisis directors meetings today. We brought all of our crisis directors from our community mental health centers across the state in a room, and we were so honored. Governor Beshear came and spoke and acknowledged the work that they're doing around 988, but he also made a big announcement, which I want to make sure everyone knows, is that the Find Help Now platform has been relaunched to include not just the substance use treatment locator that you're familiar with, that Van has helped to take charge of, and our KIPRIC, our Kentucky Injury Prevention Center, but we now have a mental health treatment locator, just like our substance use treatment locator. Find Mental Health Now, KY. Not only mental health treatment locator, we have a recovery housing locator and a naloxone locator. So you go to one platform, Find Help Now, and you can then click on any of these links to find real-time access to where recovery housing exists, mental health SUD treatment, and that naloxone. So excited about that, and we'll share the link around later today. And I'll just finish with Happy Pi Day, guys. 3.14 159 65358 7373.
Yes, sir.
Thank you. From the Kentucky Department of Veteran Affairs, we have a few events across the state. I will send the flyer out through Shauna to see if we can get approved to send to you all. But March 20th, there's a PTSD awareness event in Elizabethtown, Kentucky, with KDVA and the DAV. It's going to be to give information regarding that next week. The flyer will come out March 21st. There's a KDVA is doing a homeless and SMVF resource event in Williamsburg. So we'll send a flyer out on that day. I mean, for that day. March 28th is the third Governor's Challenge Suicide Prevention Lethal Means Summit. It's going to be in Paducah. So that's going to be all day on the 28th. April 18th is the same thing for the suicide prevention in Erlanger. And then April 25th, we have a KDVA Benefits Claims Clinic in Carrollton, Kentucky. I'll send a flyer out for all of these. For Carrollton, anybody who needs to update a claim or things like that, or requesting assistance with the tuition waiver, they can do that in person, come in right quick and get help in that region. So those are a few updates. Again, I'll send all the flyers, and if they're approved, it'll come out through distro. Thank you.
Do we have any other commission members that may? Yes, I'm sorry.
Thank you.
Sorry, Van.
Thank you. No problem. Just wanted to say our next Senate Bill 90 Implementation Council meeting is April the 11th. I think it's 1, isn't it, Angie? At 1 o'clock here at AOC. We've talked a lot about Medicaid expansion and what a tremendous tool Medicaid substance use disorder benefit has been. When Governor Steve Beshear 10 years ago launched that program, I knew it was going to be a big deal. I had no idea it was going to be this big of a deal. We went from 4 to 6 week waiting list just to get somebody in recovery housing to, as Judge Mullen says, we can get you in this afternoon if you need it, if you qualify for a residential program. That's a game changer. We think we're going to make some announcements soon to show the progress that we are making. We are moving in the right direction. Hats off to Commissioner Lee and her staff. Behavioral health and SUD is not an afterthought. They're involved in it every single day. Answer every call, answer every email, always ready to work on this issue. So good things are happening.
Sure are. Do we have any other commission members have any initiatives either in their agencies or in their community you'd like to share with the commission? Yes.
So just to share with everyone here, because if you work in advocacy for people in Kentucky, you probably know this person. This coming Tuesday, the 19th, is Jewish Heritage Day at the state capitol. And this year the community is honoring John Rosenberg from Prestonburg for his
Amazing man.
commitment to Kentucky with the Louis Brandeis Jewish Heritage Icon Award. Just want to share that because I know that, like myself, many of the people in this room have worked with John on various initiatives to benefit the Commonwealth. That's all I got.
Anyone else? Well, if we have no one else, it looks like we're right on schedule. And even if we're running over, that's fine too, because just an amazing wealth of information I think has been produced here today. In closing remarks, Justice Lambert, our commissioner, is not able to chair of our commissions. She said it's extremely loud where she's out. So on her behalf.
It is
Well, she
loud
made
here.
it.
Hey.
Okay.
It is loud here, but I just want to express my joy in listening to all the things I've heard today from the working committees and the announcements. Earlier, when former Chief Justice Minton was on, he and I were texting back and forth to one another. Imagine that while a Zoom meeting's going on. I don't think anybody's ever done that. But we were both bragging about how this is all coming together. This commission was his project at the end of his tenure as Chief Justice and right before his retirement. So I know that he is proud of all the work that is being done. It's just very, very significant work. And I've always said this commission's work is going to live far beyond any of us and truly make Kentucky a better place. And we all.
Well, I do too. I can't tell you though, I'm trying to figure out what Jonathan's, he, I don't know.
I think that Justice
I know
has accidentally gotten his speaker going. I had texted him again to see if he wanted to say a few words, but it sounds like he's on a call. But in any event, I know that he's impressed and has expressed that to me. So thank you all very much.
And if I could just add very quickly, again, on behalf of Justice Lambert, myself, we want to thank you so much. Actually, I know former Chief Justice Minton, I wanted to acknowledge he's been there faithfully throughout the entire meeting today, but it was his signature and acknowledgement of the need of this commission in the state of Kentucky that implemented it and got it started for us. So on behalf of the commission, we'd like to personally thank him, and I appreciate him taking time to be with us. I would also note that it's probably the most relaxed I've seen him in several in several years, but there's something about not being chief I think may have caused him to be a little more relaxed. But first of all, again, as I said earlier, we appreciate so much every member of the commission. We have some new members. I would still encourage our new commission members, if you're not part of a committee, believe it or not, it's still not too part of you've heard something today or a committee you may have an interest in and you're one of our newer members, please let us know, let Shauna know. I promise you we'll try to work you in wherever and whatever committee you may want to try to serve on. We appreciate it. I can tell you there's, as far as I think they meet maybe once a month, some committees meet a little bit more, but we would encourage you to, when the committee meets, to, obviously if you can at all, if your schedules, to be present, because honestly, we value each and every one of your input. And the committee individually your input and your thoughts is what drives this committee. It has from day one, and I'm sure with your input, it'll continue drive us into the future. And we just know we're going to accomplish such great things. And I've said before, it's an honor for me to serve on this committee. Want to remind everybody, our next meeting will be June the 13th here at AOC. I hope everybody has a wonderful drive home. At least when we came in and shut the doors, it looked like it was nice and sunny out, and that's why we shut the doors today. But I do hope everyone has a safe trip, and thank you so much for being here today.